and thanks for attending the Transformation Region Summit and the Prosperous Communities breakout stream. My name is Kylie Porter and I'm the CEO of Greater Whitsunday Alliance. When we talk about transformation and the opportunities in transformation, we tend to focus on those hard technical skills, which are jobs which are going to be transformed into the future. So things like autonomous haulage, ag tech, and a whole range of other technical robotic type skills that are going to be required to drive the jobs of the future. But in reality, digital technology is going to impact every single job and every single sector across our region. The focus of today's conversation is around exploring what are the opportunities around digital technology in the health, community and social sector. And I think it's a really great opportunity for us all to sit and actually explore, really what the future of our region can look like when we embrace digital technology and it rolls out even further. So the last few months of COVID-19 has accelerated the rate of adoption for digital technology, immensely. So advancements in terms of engagement, we've achieved things in the last 4 months that possibly would have taken 3 to 4 years to achieve outside of the COVID experience. So I think it's a great opportunity for us to sit down and look at what else can be achieved, where we currently sit across the region, and how else we can actually leverage technology to ensure that service delivery, particularly in the health and social services sector, is enhanced, not diminished by digital technology into the future. So please join with me as I talk to Nicolette Ffrost from the Neighbourhood Centre and Dr. Melissa McCann from Whitsunday Family Practice, so we can explore what's actually happening across our region already in digital technology and prosperous communities. Hi, thanks for joining us for the panel to have a conversation around prosperous communities. Today with me, I have Nicolette Ffrost from the Neighbourhood Centre and Dr. Melissa McCann from Sunday Family Practice. Thank you, ladies, for joining us. Nicolette, I'm going to get you to introduce yourself and give a little bit of background about yourself and the Neighbourhood Hub so we can frame the conversation.
Thanks for that, Kylie. Like Kylie said, my name's Nicolette. I'm the General Manager of the Neighbourhood Hub. We're actually a special day for us today, the 1st of July, because it marks 12 months since we've rebranded to the Neighbourhood Hub from last year. So previously we were the George Street Neighbourhood Centre and our other centre on Shakespeare Street, the Shakespeare Child and Family Centre. But for the last year and hopefully for a lot longer, we've been known as the Neighbourhood Hub. We've been around the Mackay region for 30 odd years and deliver a number of program and activities and events for the local community. Our vision is a resilient, empowered and connected community, and everything that we do aligns with that vision. I've got a fabulous team behind me, very passionate about what they do, love what they do, and I guess in this current situation, when looking at the pandemic and coming out of the recovery side, our vision is not only as important as it was last year, but very important to keep this community connected.
Thanks, Nicolette. Welcome, Melissa. So I'd love to hear a bit of background from you and about, where the organisation that you're representing today or the sector you're representing today.
Thank you so much. So Melissa McCann's my name. I'm a GP and owner of Whitsunday Family Practice and our skin clinic. We also are lucky to have a really passionate and engaged team. General practice is never just the GPs. Our team, particularly during this pandemic, our nurses, our reception staff, have really been at the forefront of, dealing with and really a constant change in processes, procedures, their roles. So it's been challenging, but it's a team that have really taken it on board for us to be kind of leading the way and doing everything we can to keep the community safe. So I guess that's been us through the pandemic. In terms of pre-pandemic, we've been around since 2015, started as a small solo GP clinic, and we've now expanded to a team of 9 GPs and a large purpose-built site and an adjacent skin clinic. That's us.
Excellent. Right, yeah. So we've got two, both involved in, community health, social sectors, but probably slightly involved in those in different ways. So I'd love to have a quick conversation with you both and ask you both the same question, really. So we typically think about digital technology as being a disruptor. So it is actually disrupting our community, and there's a lot of people that feel very fearful around that disruption, that we're going to actually remove the social connection that's often involved, particularly in your sectors that are so critical. Have there been any learnings from the last couple of months that probably have made you think that rather than it actually be a disruptor, it's actually been a help or been a connection tool that's actually enabled the better delivery of services?
I think for us, I look back on that March, the 23rd, Monday, the 23rd of March, when we had planned, I guess, an event, Harmony Day event that was due to happen the following, the day before actually, which was to be cancelled. And I think that, we were kind of wary around that digital and moving everything to a digital world and whether it would be disruptive. I guess as a community organisation, we engage with the community. So what does that look like when you take away face-to-face, particularly with vulnerable community members as well? And I went back to our Facebook page and we actually did our first online event on March the 27th, which is, 5 days later. And I look back now and I think, how did we actually achieve that in such a short amount of time? But now that I guess we have a little bit of a hindsight and there's a little bit of, space between the March to, the beginning of July, I think it's changed things a lot for us. It hasn't been a disruptor. We still have had to go back to that face-to-face with some of our clients and some of our service users, but for us, it's changed the landscape. I guess for an example, we deliver Healthy Kids Are Happy Kids with the local naturopath, Jodie Walker. Traditionally, we deliver that at 43 Shakespeare Street. Registrations are capped between 25, 30 is probably pushing a little bit too much. We had 80 registrations for one of her workshops. So for us, it was an eye-opener, I guess, into some aspects of the community engagement that were missing and a gap. And I think for that particular program, we would be really silly to put the blinkers back up and say, well, we'll only do face-to-face, because we're missing out on, mums and dads and grandparents and carers who may or may not have been able to get into the centre, who can still access that information at a later date and really get the same content just via a different method.
Absolutely. And Melissa, I particularly in the medical sector, the federal government was really quick to introduce some telehealth options or to push telehealth options. What about from your perspective? Has it been eye-opening about the connection opportunities it's provided, or have you found it disruptive? Oh, have we still got you, Melissa? Are you back? Have we still got you?
Oh, perfect. Literally, I was about to write you a message. So I'm so sorry. I think maybe a good timing to see one of the challenges we've had with technology, which is our internet here is actually poor, and so I just lost you for a few minutes there, and I've just tried restarting it from my Wi-Fi. So I'm sorry, I just missed that, but yeah.
So we finished off by saying that there's some opportunities around greater, so Nicolette's experience has been is that some of their service and some of their program delivery through COVID-19 has actually reached more people than they typically would have been able to, with that old traditional face-to-face service delivery. So has that been the experience in terms of the medical sector? Because I know that the federal government was pretty quick to, really encourage GPs and other service providers to look at telehealth options. Has that been your experience?
Yes, yeah. So I think similar to Nicolette's experience, it has allowed us to offer a service to patients who maybe would have been really uncomfortable sitting in a waiting room, didn't want to leave their home. Some of our patients who normally have to travel long distances, who work away on mine sites, or we have a number of patients who work on the islands, things like that. So we've always offered a telehealth service, and that has been popular with some of the residents on Unitaid and Hamilton, that type of thing, and some inland patients. But this has really allowed us to extend it more broadly, and obviously the government has provided funding to make that viable as well. Similar to, I think, just before I cut out, I heard Nicolette mention that for some people they've not been as comfortable with it and they've wanted to maintain the face-to-face, and that's definitely been our experience as well. Not all of our patients have felt immediately comfortable with consulting with their GP in a different way, particularly if they had something personal they wanted to discuss. So there's definitely been some barriers to that, technology and internet barriers to that as well, and definitely patients who've I think struggled with the move to telehealth. So we have been, up until last week, when there were no further declared hotspots and the borders opened, we're back to doing primarily face-to-face consults. But prior to that, the majority of our work was actually teleconsulting. So it's a big change for patients.
So obviously you're both saying that, you can see the fact that, you're both currently offering, I suppose, a hybrid model of, digital as well as, face-to-face delivery. Do you think that beyond this current crisis, this is actually going to be a model that you'll pursue more formally, making that, digital, connection, as well as, still maintaining the importance around face-to-face for those people who particularly need it and request it? So is it something that you think that you'll continue on with, Melissa, moving forward?
I guess that's going to depend on MBS item numbers in terms of the feasibility of that long term, what decision the government chooses to make around that. Definitely we'll continue to offer it in the way that we had even pre-COVID. And but actually speaking to all of our doctors, while initially there was a lot of anxiety about potential risk to health workers and to our staff, all of our doctors, I think, are at the point now where it's like we miss seeing our patients, we miss that face-to-face, pretty much unanimously, apart from one or two doctors who are, because of their own conditions, at high risk themselves, who will continue with telehealth. Other than that, we want to go back to seeing our patients face-to-face. So it's definitely the default now, but we would keep offering the telehealth for as long as we can, and as long as some patients are choosing that.
And what about you guys, Nicolette? So is it as new financial year, you've obviously had to do some planning and some budgeting for how you're going to run events and programs in the future. Does digital events or virtual events or digital connections actually play a bigger profile than what it did previously?
I think for us, definitely. You can't take away that face-to-face element for some of the programs, particularly when you're looking at the family support programs where workers are going into people's homes. But when you look at virtual events, and I mean, I guess I still feel we're in a state of flux as to what the landscape looks like for us moving forward in terms of our signature events, where we used to be able to have 100 people in the backyard of George Street. That's not going to happen for some time, I guess, even after social distancing rules are relaxed even further, because there still will be some anxiety, from what happened on, March onwards. So for us, for some programs, I think it's been a real eye-opener for what we can achieve moving things onto an online platform. We even hosted the biggest morning tea in May and raised over $400. So for us, things like that, it's just, I guess you don't always want a pandemic, but I guess it's been that experience that has pushed us to maybe at times an uncomfortable situation where we weren't quite sure of what our skill set were. But if we came back to what we're good at, and that is being innovative and being flexible and being adaptive, we've just tweaked some programs to make sure that service delivery wise, we're still achieving what we were pre-COVID. But also I think from a community development framework, it's really opened our eyes up to what the community wants from us and what we can deliver back. So it just depends on individual programs. But for the majority of our programs, I feel life going forward will always have a digital aspect, because we're reaching a target audience that we weren't able to do beforehand.
Yeah, I had a great, an expert in this space talk about earlier this week where they said, what we've actually achieved in 4 months typically would take something like 3 years in terms of getting people ready to make that adoption. We've literally adapted, over a course of weeks, if not months, in something that typically, we would have been pacing out over 2 or 3 years. So it's pretty incredible. So if you had a crystal ball, Melissa, and you were to say, or a magic wand, what would you say? How can digital technology and the changes around the fourth industrial revolution and all of those buzzwords, how can they actually help service delivery for, say, a GP or like a practitioner like yourself and a practice like yourself?
Look, I think the biggest, magic wand for us that's come out of this is just the changes in regards to specialists. So perhaps not so much GP delivery, although there've been some positive changes there. But for example, I've had a number of patients who see a particular specialist in, Brisbane, and they may have struggles with travel, and they've always struggled with it, but it's always been, no, you must come down here. It's sort of face-to-face, which obviously is the ideal model of care. But then because this has happened, all of a sudden, patients have said to me, wow, all of a sudden they can do it. And, it's paved the way for patients in rural and regional areas to access specialist care. And that's a huge support to GPs as well, because that means we can better coordinate care and have our patients not having to travel so far. We can work with specialists, which in the past there just seemed to be so many barriers to that, whereas this really has, and I don't know if that's funding across the specialist space, MBS as well, but for whatever reason, this is now happening with a lot more frequency, and patients really do appreciate that, especially if they have to travel a long way for just a follow-up or a coordination of care, and the ability to do that through technology with the help of GP. This is something that I think is going to make life a lot easier and improve the care for our patients.
So what happens in the case of somebody, like as we've talked around, not every sector or not every group within our community is actually digitally literate, so they might be, elderly or have some disability which actually prevents them from. So how do we actually make sure that no one gets left behind, particularly in the social sector and in the health sector, in terms of that service delivery? How do we ensure that the lack of digital literacy or technology is not a barrier as our world moves so incredibly fast at the moment in this space? Nicolette, what do you think? How are we going to bridge that divide?
It's a tricky one because, even for us, we move so quickly on that digital online world. So there were probably some of our participants or our clients who just did not have the resources or the technology to get to that space. So that was something that we tried really hard to navigate. We worked with our own IT company to see if we could do like home visits to get people connected, whether it was through Microsoft Zoom, Microsoft Teams, Zoom, or the like. I think for some, it's also about, we're looking at information sessions that we hold. Now we can have events back at George Street and Shakespeare Street to look at how to connect to those platforms as well. But it is it's a really tricky thing, and I don't actually have an answer as to how to navigate that space, because it's like anything. You go onto Facebook, but you can't assume that everyone's on Facebook reading the messages that we're delivering, websites, info alerts, all those type of things. It's hard to navigate, and I think it's hard to manage. And it's not always a case of just additional funding so people can buy more computers and all of that, because for us, we have 4 programs that work with local multicultural communities. So, cultural barriers or language barriers can also be another thing that we have to navigate. But I think for us, it's having a face-to-face platform where we can, for those individuals who are not able to connect digitally, but also having that online platform for anyone who feels anxious about coming to the centre or who isn't well, particularly in the in the winter and the common cold and flu months as well. So maybe we have a balance of both at certain times to make sure that we're accommodating for everybody or the majority where we can. But it's tricky.
What about you, Melissa? Because you've highlighted it, that you've got some patients who are not going to be able to transition into digital, for whatever reason. So how do we help bridge this, this gap or this divide, for them, particularly from a medical service delivery point of view?
Yeah, so I think
if you've got a perfect solution, we'd love, I think the whole world's waiting for you to tell us.
It's not a perfect solution, and I'm not sure how much of a difference that our little clinic can make. But one thing we do is so initially, as soon as this started, we purchased video cameras, speakers for all of the computers within the practice, so that every room's fit up with that. And what we've done for patients who either don't have the technology themselves or aren't familiar with it, then they will often come in and maybe they'll have their Skype session with their GP using our facilities. So we do that quite a lot. And then if there's a need for, let's say, examination. So last week I had a child doing a video conference with a paediatrician, and while we're talking, I'm examining the child, showing the specialist. So it's all sort of being done in the one room, and then it doesn't matter if the patient doesn't have access to that facility because they're utilising our equipment, and so that way they're not missing out on having that specialist consults. So I think that's helped, and then I think there's no substitute for the personal side of making sure that nobody's missing out, and that's where sorry, I thought I just lost you there. That's where our front of staff and our nursing staff have just been absolutely key. They sort of come out every week or so, I haven't seen such and such, a couple of our elderly patients, haven't seen or heard them in a while, I know they don't have family here, let's just give them a call and see if they're okay. And so they'll just ring and say, is everything going okay? And 9 times out of 10 they're absolutely fine, but it just means that we're doing, I guess, what little we can do to make sure that there aren't isolated patients within the community who don't have any support and don't have access to technology.
So before COVID hit, had you actually practiced those types of, GP specialist online appointments with patients before, or is this something that you guys had to adapt very quickly to based on the environment that we were in?
We had done it before, but on much less frequency. Yep. So everyone was familiar with it, but it was just really a matter of getting enough equipment that all rooms could be utilised in that way, so that the increased number of patients could benefit from that.
Yeah, and in terms of, if we're to probably take that holistic view around the health system, I'm imagining that's quite, and as I said, as you rightly pointed out, there is no substitute for one-on-one care, particularly around your health. But for some of those appointments that perhaps can be managed, remotely, virtually, this has to add some efficiencies into the costs of delivering quality healthcare.
That we've not mastered yet, so I would say we are less efficient. Simply because I guess some of the technology isn't really in place, so there's no streamlined way to get a paper prescription to a chemist. And especially when our doctors were working off site, so we had to quickly come up with the best solutions we could, and I think we did comparatively well. But where things need to be handwritten, the doctor's remote, and then we need to get that script signed, and then we need to get that to the chemist and scanned in. And so a lot of increased work for our front staff in terms of faxing and scanning and getting paperwork to patients, to pathology, to radiology. So efficiency is definitely less. I think it's increased the workload, but it's been the only way to manage it.
So not there yet, but could be. But could be, rightio. So that's really interesting. And I don't know if that's been a similar experience for you, Nicolette, has been your service delivery, has there been, equally, I think you're both really right to point out the fact that being able to manage digital technology or the adoption in such a short period of time creates a whole lot of challenges. Like you said, you went within a week, had your first digital event, virtual event, and the resources that it would have taken to have made that happen are extreme and a lot. But can you actually see longer term that there'll be some efficiencies, whether it be around cost or whether it be around how quickly you can deliver information and services, to the clients that you work with?
Yeah, definitely. I think if we have an emergency relief program which has been operating since February of 2019, and I think when we looked at moving that program, because obviously we did that work from home for about 4 weeks, how are we going to still deliver that service to really vulnerable people who needed it more than ever, really? So we worked on, I guess, e-vouchers and being able to email vouchers, whereas if you had have asked me that like 6 months ago, I would have thought you were crazy even trying to suggest that. So I think for that, it's enabled us to be efficient in that regard. So we can reduce, I guess, that face-to-face contact. Like I said, if people don't want to come into the centre or feel that they're not able to, I don't think we're there for all programs as such, but maybe that's also because of how that program's structured. It may never get to that point because of that face-to-face, like Melissa said, that social engagement and interaction. But I think, we moved the team off-site gradually over 2 weeks, so a week and a half. So we made sure we had the resources before everyone went off-site. I think that was a blessing because we could continue to do things in the office as much as we possibly could, as well as having some staff who are working at home. But yeah, in a nutshell, I think overall it will improve our efficiency. We're not quite there yet, but we also, it's only just July and this has happened, March. So it's just, like I said, been an eye-opener for us as to how we can move forward in the digital world.
So the thing that I'm hearing from both of you is that without a really great, strong, committed team that you had working around you, that some of these adaptations just would have been pretty hard to have achieved, and being able to implement to make sure that your community was still serviced well. How important, from your perspective as employers, you're both employers, how important was it for you to have inherent digital literacy skills within your team that operated around you?
I think it was important, but I think more importantly, it was having a team that was flexible and innovative and creative. And I mean, to be honest, my team's probably sick of me to a certain extent saying those three words, because I have probably said them a lot over the last, 3 or 4.5 years that I've been here. But I feel like that the last 3 years have been the foundation for enabling us to take our programs online with a short period of time. Having the digital skills, that's an added bonus, but I feel as a leader of a community organisation, having that team who's so committed to being flexible and being adaptive, because even at home things go wrong. Things go wrong in the office, they go wrong out of the office with IT. So being able to move, being able to position themselves differently in their programs, that's a blessing as well. But I also think for us, the partners and the stakeholders that we've worked with over the last 3 years, we get to do some really wonderful and kind of weird things at times, and we've built that rapport, that trust. So when we say we need to do things a little bit differently, I guess they have the faith in us because they've worked with us for so long that we can move it to another platform, and we're not really quite sure of the end result. I mean, the end result's been great, but we didn't know that when we were doing this in March. But the shared goal, which is all, that's partnership brokering 101. So we've got the foundation not only with the team, but also with the partners and the stakeholders that we need. And I think that has been just as important as the digital literacy skills as well.
What about you, Melissa? How critical, because it's pretty important, isn't it, to say, hey, we've got to change the way we deliver our services, and we're all in it together. So how important was the digital literacy in your experience?
Yeah, look, I think that was actually a good summary from Nicolette, and a similar experience for us. Definitely all of our staff obviously have, I would say, maybe like above average digital literacy to start with, just inherent to the role that they're required to perform daily and pre-COVID, but being flexible also for us, I love those words, was just so key. It was, at one stage there, literally every day, it was a morning huddle meeting. Okay, now these guidelines have changed. This is the swabbing criteria. This is the contact tracing criteria. This and this doctor has to quarantine and work from home, so blah, blah, blah. And so we bring these patients, and literally every day there was a change to the government screening criteria, to, contact tracing criteria, to how we were going to do things. So that just required a huge amount of flexibility from staff who were stressed themselves. It was initially, I think, a scary time, the idea of this kind of unknown virus and how bad it might get in our area. And then innovative as well. I think that's the advantage of being a fairly new practice. We've always had the philosophy that we never want any of our teams sort of saying, well, this is just how things are done, and leave it at that, but always welcoming new ideas and encouraging all of our staff to come up with new ways of doing things, innovative processes, because it is a constantly changing environment, and the needs of our doctors and patients and staff do constantly change.
So as we look beyond, the current crisis that we're in, and I don't know when we start looking beyond that, because there doesn't seem to be any, we don't have a stop date identified yet, unfortunately. But as we look beyond the current crisis, do you think that your learnings around where those skills that you've just talked about. So yes, digital literacy was important, but so was the ability to be flexible, creative, adaptive, I suppose a little bit fresh in your approach to things. Do you think that they're actually the skills that we broadly all need to support our communities as the world transitions, because of technology? Are they, do you think that these are things that we're going to hold on to and keep evolving from now on?
I think so. I think, for some, if you like consistency and being in control and being organised, a pandemic
go home.
Yeah. And I think that, I know for my organisation, there were times that we really tested and we had to go to a skill set that we possibly didn't even think we would ever need to utilise, myself included. So I guess, when we're looking at the future and looking at the future of the local Mackay community, you don't want things to be, you don't want a team member to be like, well, we only do this because we do this, but no one really knows the reason why. So I think for me, it's about a team that can be flexible, and we can, maneuver where we need to and adapt to whatever comes our way. And I think when you do that and you kind of let go of that control element, it naturally goes to new, fresh ideas and, like I always say, weird and wonderful concepts. But I think we need to continue to test that in order to see what's happening with our community, and also for us as a community organisation.
What about you, Nicolette? Are these skills and attributes that you think we need to hold on to move forward successfully, as communities, in a post-COVID-19 environment?
Look, absolutely. I suppose these were the skills and attributes that pre-COVID, I valued and thought were important, and so did my team. And I just think there's just going to be potentially crisis after crisis, like that is life. And 3 years ago, that helped our team manage well with the cyclone, and then now it's allowed our team to get through, even the really difficult time that we've had now. And there no doubt will be other challenges for the team to face in the future, and I just think they are fundamental characteristics to being able to handle what life throws at you.
Look, I've taken away some really important learnings from both of you. One is that digital technology is great because it actually enhances what we can also achieve face to face. There is no substitute for person to person contact, and when we're not looking at a world that's controlled by robots, particularly in the community health and social sectors. So that's my number one takeaway. That for kids out there who may be watching this panel conversations, there's going to be jobs in health which is based around one-on-one service delivery in the future, but they'll be combined with technology as well, which makes them pretty exciting. So that's my number one takeaway. And the other one is that our skills of being creative, resilient, adaptive and flexible are not necessarily things that are hard to teach in schools, but they're very important, to foster in, as attributes in individuals. Have I nailed them? Do you think that I'm on the money there, or have I completely missed the point of our whole conversation?
No, I think that's a great summary.
Excellent. Yeah. Well, look, I'm going to wrap it up there, ladies. Thanks so much for joining our conversation around prosperous communities into the future, and and for the launch of the Transformation Region platform that we're launching into our region, Mackay Isaac Whitsunday. Thanks so much for joining me, and we hope to loop back into you sometime soon to be able to find out where you guys sit at that stage, some stage in the future. So thanks, Nicolette. Thanks, Melissa.
My pleasure. Thank you.
No worries. Thank you.